So welcome everybody to the second webinar in the LINEA and CPC Learning Network joint webinar series. We are very excited to have you with us. As many of you may know, the aim of the series is to profile the most cutting-edge research and programming on social norms and prevention of all forms of violence, exploitation, and abuse of children and adolescents. I'm Marie-Céline, the Research Fellow for the Learning Initiative on Norms, Exploitation, and Abuse, the acronym is LINEA, which is an international and multi-pronged project exploring what the potential is of social norms theory and approaches to preventing sexual exploitation and abuse of children and adolescents. And like the CBC, the LINEA also hosts a network of partners in research, programming, policy, advocacy, and funding, and we are situated within the Gender Violence and Health Center at the London School of Hygiene and Tropical Medicine. And the CPC Learning Network is, as you know, housed at Columbia University Mailman School of Public Health, which convenes academics, policymakers, and practitioners to promote innovative research, nurture communities of learning, and build the next generation of researchers and advocates for children and families worldwide. So we're very excited to have Dr. Holly Shakya with us today for our webinar entitled Social Network Analysis as an Innovative Tool for Identifying Reference Groups. Holly Shakya is Assistant Professor of Global Public Health at the University of California in San Diego. Here she is. Thanks for being with us, Holly. The focus of her work lies at the intersection between social norms theory and social network analysis, with a special focus on norms measurement. And some of her current projects include the determinants of adolescent fertility in Honduras, norms and network impacts on adolescent marriage broadly, fertility and contraceptive use in Niger, a network study on female genital cutting in Senegal, and a qualitative norms and network study on child marriage in Cameroon. So we hope that you'll find today's webinar very stimulating and engaging. We'll have about 20 to 30 minutes for questions at the end. So thanks everybody. We'll turn it over to Holly.
Okay, wonderful. Thank you everyone. I showed you myself on the webcam for just a few minutes there to try and make this a little bit less abstract and impersonal, so I'm not just a voice talking out into the ether. It would be great if I could see and hear all of you, but this is exciting because it allows lots of people to join us from all over the world. So I'd like to thank everybody who invited me here. Mark, Lottie, Marie-Céline, and Nicholas has done an amazing job setting everything up. So thank you so much for inviting me. I'm excited to present this research. This is going to be very brief introduction to social network analysis and a very brief overview of social norms theory. Some of you are probably familiar with social norms theory and maybe some of you are not. This is just going to be touching on it, and then I'll talk more about the work that I do, some of the work that I do, and how it's relevant to this question. Oops, oh wait, okay. There we go. Okay, so there's a moral to the story here. And the moral to the story is that social networks impact health. Da, 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 da. So we kind of have an intuitive sense of this, and there's been more research recently that has been sort of honing in on this. And part of the reason for the interest is that places like UNICEF and the Gates Foundation have really come to understand that very individual focused interventions a lot of times just don't work. And the reason they don't work is because people's behaviors operate and are influenced within social contexts. So for instance, if I want to use family planning, but everybody around me disapproves of family planning, that's going to be impediment to me. So just going in to tell me to use family planning without addressing that social context can cause problems. So there's a lot of interest in social norms theory for this reason. And when we think about social norms theory, social norms take place within a context, and social networks are that context. So social network analysis can help us really fine-tune our understanding of norms, how those norms are being held, maintained, and changed within different contexts. What we know also is that socially connected people tend to be similar. So why do we care about that? Well, when we look at the connections between people and those similarities, we can come up with sort of different mechanisms by why this is the case. So if all of us are, say, eating chips and sodas, and people are wondering why we're all engaging in an unhealthy diet, they may realize that we all live in an environment where there's nothing but fast food restaurants. So there may be something in our environment that's causing us to behave similarly. And in that case, an environmental intervention may be the most appropriate. We all may be similar because we choose to be friends with people that are similar to us. So this is a concept called homophily. It means that similar people hang out with each other. So I'm going to be more likely to be friends with somebody with my same level of education. It may be based on race or ethnicity. It may be based on income levels. It changes depending on the context. But when we see similarities between people's behaviors, we have to ask, is that similarity because those people are just similar and that's why they're friends with each other? That gives us a different approach when we're trying to think about norms and behaviors than, say, the last dynamic, which is that there's influence. So if I'm friends with somebody and that person starts exercising, will they influence me to start exercising? On the counter of that, if I'm friends with somebody and they start drinking 2 bottles of wine every night, am I going to be drinking 2 bottles of wine every night soon too? Because every time I go to their house, they're pressing me to drink wine. So we look at these different mechanisms and we want to understand how these behaviors are being transmitted and how much of that actually has to do with social norms. So this is a super brief introduction to social network analysis, but just to sort of orient everybody that we're all on the same page. So let's say that we go into a village in rural Honduras, which we have done, and we're going to collect social network data. So we have one village. We're going to collect social network data from an entire village. And we're going in and we're going to ask this question: who do you trust to discuss something personal and private? Now, this is just an example of a question. We could ask 10 questions. We could ask very different questions, but we're going to ask this one here. So we ask this question, and then we have 2 men. We'll start out with them, Jorge and Miguel. And we see that there's a connection between them. That line means there's a connection. But what is the nature of that connection? Well, we can see here that Miguel named Jorge. So when we asked Miguel that question, he nominated Jorge. But now Jorge also nominated Miguel. And what this tells us is that this is a reciprocal relationship. These 2 are socially connected. Miguel nominated Jorge. Jorge nominated Miguel. They nominated each other. And this reciprocity shows us that this is going to be a stronger type of relationship, and potentially they will be more influential with each other. Now, when we put these figures together, we use different characteristics to highlight the different things that we're interested in depending on what our research goal is. So in this case, we've made squares male, and we're making circles female. We're going to make orange an adolescent pregnancy or an adolescent parenthood, since none of these are men. They didn't have pregnancies, but they could have been fathers. And blue was not. Now, this is an arbitrary choice based on what we are looking at and what we think is important. We could have switched these. We could have made pregnancies the shapes, and we could have made gender the colors. But in this case, we wanted to highlight the pregnancy, which is our main outcome. So we made it orange so it pops out so we can see it. And then we take these nodes and we can make them bigger or smaller. And in this case, we calculated a measure of how central each person is in the network. And the larger the node, the more central that person is in the network. And so now we see we've got a little cluster of people there. They're socially connected. They're friends with each other in some way. They discuss something personal and private with each other. And we've got another little group down there. Now, if we weren't doing a full network, we might end up with something that looks like this. But in this case, we have a whole village, and we've interviewed the whole village. And what we see now is this complex, comprehensive picture of how all the people in this village are interrelated with each other based on this question. We can see who are the ones who've had adolescent pregnancies and who have not, who are the most central, and who are men and women. And just from a brief glance at this, what we see is that mostly adolescent parenthood are women. So girls are the ones who've been having adolescent pregnancies. There's not that many men who are adolescent fathers. And we see that these girls who've had adolescent pregnancies tend to be clustered together. So we see clusters of this. Now, these diagrams are not our statistical analysis. This is the way we sort of show what we're doing, and it also can give us a sense of what's happening in the network just by looking at it. It gives us a sort of a different way of understanding how these things are working together. Now I'm going to talk very briefly about social norms theory, and then I'll go into some of my research to give examples of actually how this all fits together. So the social norms theory that myself and my colleagues have used mostly is based out of social psychology. Work by Robert Cialdini was very instrumental in sort of putting this together. And we use this because it's relatively simple to use. The constructs are intuitive. So we start off with this concept of descriptive norms. This is what we observe of others. What's important to understand about this, though, is that it's not just what I observe of others, but it's actually what I think others are doing. So I may think that others in my community are drinking a lot of alcohol. That's my descriptive norm. It's my impression of what people are doing. Now, if you were an alien, you came down to Earth and you were wondering about cell phones, well, is it appropriate to use cell phones or not? It wouldn't take you very long to decide, oh yeah, okay, cell phones. That looks good, everybody's doing it. So you get two impressions from that. One is that the cell phone is appropriate to use, so people aren't going to be angry at you or look down upon you if you're using the cell phone. And the second thing is that there seems to be some benefit. Well, everybody's doing it, they must be getting some benefit out of it. So your chance of using a cell phone in that case would be relatively high because you'd see that it was both appropriate and there may be something beneficial about it. When we're thinking about injunctive norms, we're thinking about things that other people are socially invested in your behavior around. So they're going to reinforce rules of behavior. So as an example, if we were all in a big auditorium and I was talking and somebody's cell phone went off and they stood up in the middle of my talk and started talking on their cell phone, they would be hitting up against a pretty strong injunctive norm. That's not appropriate. You shouldn't be talking in the middle of somebody's talk. Please leave the room, maybe not invited back, maybe ostracized in some way. So this person didn't comply with the norm and then incurred a sanction. So these injunctive norms are reinforced and maintained through sanctions. So these are consequences of not complying. Now, of course, a descriptive norm can also be an injunctive norm. And an injunctive norm generally would have a descriptive norm with it. So you can have a behavior, for instance, in my neighborhood, people litter a lot, and that is a descriptive norm. It seems to be appropriate. I'm not sure whether people actually think they're getting a benefit out of it. Maybe they think that it's saving them the trouble of walking 3 feet to a garbage can. But nobody's going to sanction someone for not littering. So there's a difference there. Changing norms means that the changing individual beliefs is not sufficient. And it's really, really important to understand the distinction between a norm and an attitude because it gets conflated all the time. So there's a lot of research that claims to be looking at social norms, and what they're really looking at are attitudes, individual attitudes. Now, the reason for that is that there are not a lot of surveys that have good social norms measures, but just assuming that an attitude is a social norm isn't appropriate. But there are ways, and I'll show you in some of my research, that you could take attitudes and start sort of getting evidence towards social norms. So you can't just change an individual's belief if there's a norm and expect them to change that behavior. Even if you get every single person in the group to change their belief, if they don't think that others have changed, and if they don't think that those sanctions are changing, they're not going to change their behavior. So they need to know that there's not going to be sanctions, and they need to think that other people are also changing their behavior. So here's the main question of this talk, which is, who are those others? So that seems intuitive, and it seems like it could be easy to answer, but in fact, it's actually not that easy to answer. So this is what we call the reference group, and these are the people to whom individuals turn for expectations around their behavior. So what do these people approve of? What are these people doing? Who's going to sanction me? How are they going to sanction me? And if norms change is going to take place, it's very important to understand who that reference group is, because if you're identifying and trying to make change within the wrong group, you're not going to see the change that you expect to see. And reference groups can be complex for a couple of reasons. One is that there can be different reference groups for different behaviors. So as an example, let's say we have a woman in a rural village in Africa, and she has an interest in going to the market to sell some of her vegetables. So the first layer of norm would potentially be her family and proximal neighbors who are going to either approve of or disapprove of her desire to go sell things in the market. So if it's a very restrictive community, they may say, no, women need to stay in the home. You may not go to the market. So there's the norm there, and that norm is being maintained by these people within the neighborhood and in the close family. But then when the woman gets to the market and is making decisions around how to operate within that system, that's going to be a separate reference group and a separate set of norms. So that's one thing, is that we have two different norms, two different reference groups. We can also have, within that family context, we can have elders and maybe higher level family members who are saying, no, you need to stay home. And we may have a level of people who are peers who are saying, yeah, let's start not staying home. And so there's going to be potentially different reference groups around the same behavior, and they may not be thinking the same way. So trying to understand how these things are working and where the influence is moving is an important part, I think, of changing social norms. So the first research I'm going to show you is asking the question, are villages a good proxy for a reference group? And why are we asking this question? Well, because a lot of interventions will go in and address a village as though they are a sort of homogeneous social unit. And it's important to look and understand to see whether this is actually the case. So if an intervention just goes in making that assumption, are they making the correct assumption? So this data was from South India. It's social network data. It was collected by Matthew Jackson from Stanford a few years ago. We had social network data on all of the people in those villages. Well, actually, sorry, about half the people in those villages, but we had full village network data. And what we looked at were what level of social connection was significant in terms of the behavior that we were interested in which case, in this case, it was latrine ownership. And what we looked at was, we had friendships. So who did each person nominate as a friend? We had villages, so we had cohesive social unit in terms of the village, the geographic boundary of the village. And then we had something that we call communities, and I'm going to explain what that means because it has its own meaning in social network analysis. So again, our outcome of interest was whether or not a person owned a latrine, and only 30% of that population did, so it was obviously an important issue for them. We also know that depending on the context, latrine adoption can be determined by social norms. There may be varying social factors that influence whether or not a person decides to use a latrine, to build a latrine, etc. And now the question is, what do we mean by community? So in social networks lingo, this is a group of socially connected people. They're going to have stronger within group ties than between group ties. And we're going to find these groups of people within a larger network. So in this case, we took each village, we calculated an algorithm, and we determined where there were groups of socially connected people within each village. And here's an example of what that would look like. So this potentially is one network. We see there's 3 groups. We see that within each group, they're very tightly connected, and we see that between the groups, they're loosely connected. So this is generally what we're talking about in terms of communities. And what we want to understand is, where is the most influence potentially in terms of owning a latrine? Is it within the village? Is it friendship? Or is it community? And what we found is that it's community. Here are 5 separate communities, each one color-coded. In this case, we have squares representing latrine ownership. Now, if these communities were irrelevant for latrine ownership, we would expect that latrines would be equally distributed across the communities. But instead, what we find is that we have a lot of difference in terms of that across communities. So if you look, oh wait, I have a little pointer here. Okay, so if you see here, this community here, there's very few people who own latrines, and in this community here, we have a lot of people who own latrines. And what this shows us is that the communities are potentially the most salient, predictor of latrine ownership. Oops, okay, there we go, sorry. And that's what we found, that geography was important, so people in your village owning a latrine was important, your friends owning a latrine was important, but the most important were these communities. And this was really consistent with what qualitative research in India has shown around this issue, is that because of caste and ethnicity, villages in India don't tend to be very homogenous, and they don't necessarily act as very cohesive social units. So going in and addressing a community as a whole may not be a very good strategy. So now we want to see what sorts of relationships are going to show the strongest association with attitudes. Now, attitudes in this case are going to act as a proxy for norms, but we're going to sort of create that evidence through using what we have with social network analysis. So this was done in rural Copan, Honduras. We had 2 villages and 800 people. This was preliminary data for a larger study. And our outcome here was whether people believed that IPV was acceptable. So there were certain conditions, and if a person reported yes on any of those, we categorized them as accepting of IPV. And what we know about IPV is that if you've witnessed it as a child, if you have attitudes in support of it, and if you've had violence in your extended family, you're more likely not only to perpetrate IPV, but also to be a victim of it. So IPV attitudes in these contexts are important to understand. We asked people 13 different questions. So this is a lot of questions. We have familial relationships, we have social relationships, and we have support relationships. And what this allowed us to do was look at how correlated people's attitudes were with each other across these different types of relationships. So this is really getting at what do we think might actually be the salient reference groups. So what we first found was that if a person that you're socially connected to in any of these questions accepts IPV, your probability of accepting IPV is higher. So I have a friend who thinks IPV is acceptable, I'm more likely to. And I'm using friend loosely, friend meaning social contact. Now we start breaking this down. If it's somebody that you discuss important matters with or that you talk to frequently, that's significant, that's strongly associated. Familial relationships, your mother, your father, your spouse, if any of them accept IPV, you're more likely to. Strong relationship with people in your same household. So if anybody in your same household accepts IPV, you're more likely to. No relationship with the person that's called quote unquote friend, who you borrowed money from, and who you nominate as town leaders. So these are important because this is showing where there could be assumptions that relationships are significant and they are not. And this tells us that when we do social network analysis and when we're looking for reference groups, the kinds of questions that we ask are really, really crucial. Now, what we want to also understand is, are these significant relationships just a proxy for being in the same household? Because any of these could be. You could be living with your mother, people with whom you discuss important matters, etc. So is this a household level issue or is this broader than that? And for women, it's completely a household level issue. Once we adjusted for whether a person was in the same household, those other relationships fell away. So it didn't matter exactly whether it was a mother or father if it was in the same household. But for men, no. So regardless of whether a person's in the same household or not, they were still strongly correlated on their IPV attitudes with mothers, siblings, and with people with whom they talk frequently. So the men had a wider network and potentially a more diverse reference group in terms of this acceptance of IPV. And why do we care about this? What does this tell us? Well, this is evidence of an inner and an outer norm. So in Honduras, in these villages, IPV was not very well accepted. There seemed to be a norm against it, and people were uncomfortable talking about it, and there was stigma around it. But within households, then we see that there are these clusters of households in which people are accepting of IPV. And what this tells us is that we may first of all have inner and outer norms, so the community level norm versus the household level norm, and that interventions working primarily outside the household may be ineffective. Okay, so we had attitudes, and what about perpetration? This is looking at perpetration, well, actually reported experience of sexual violence by adolescent girls. And this is using data from the AdHealth study, which has network data from students in high schools across the United States. We limited this to girl friendships. What we found was that 8% of the girls in this population reported forced sex. So these are high school girls. So we already have 8% reporting forced sex. We started to look at what our risk factors were. Well, consistent with other literature, we see that if a girl reports substance use, her risk of forced sex is higher. So this is consistent with what we've seen in other studies. But what we see here, and which is extremely interesting, is that we could calculate the friend's substance use risk score, and a friend's substance use risk score above and beyond her own was predictive of a girl's reporting of forced sex. What we also found was that when a girl's friend reported forced sex, she was also more likely to. So this is showing us a sort of clustering of behavior in which we have risk and we have perpetration that's taking place within some social context, and this seems to be being reinforced. Now, what we did then was we controlled for what schools the kids were in, and what happened was that friends reported forced sex dropped out when we did that. And what that tells us is that potentially there's something, this dynamic is happening more at the school level than necessarily at the friendship level. The friendship level may have just been a proxy for a higher school level environment. But nevertheless, the friend substance use still remains significant. So regardless of this school level context, if a girl's friend is using substances and she's using substances, she's at higher risk of having forced sex. And I'm sure most of you understand this, but just as a disclaimer, this is not in any way blaming girls or putting the responsibility on them, but definitely using substances makes a girl more vulnerable. And then what we also found, we looked into adulthood, and what we found was that this substance use dropped out. So when your friends used substances as an adolescent, it did not increase your risk of forced sex as an adult, but your friends reported forced sex did. So if you had a friend as an adolescent who reported forced sex, you were more likely to report forced sex as an adult. Okay, let's see. I don't know how much time I have left. Here's this network diagram that we made. This is showing that high risk environments for girls include friends and schools, and it suggests processes that are normative. And so this is what I'm saying, that we don't have actual norms data on this topic in this environment, but by using social network data, we can start putting together clues and figuring out where we might think that we're seeing norms. This is a qualitative study looking at child marriage in far north and south Cameroon. And what we did was qualitative social network interviews. So we also did focus groups, key informants, but an interesting thing here was doing qualitative social network analysis. We identified one girl in each village. So we had 4 villages, each with a different ethnic group. We identified a girl who'd had a child marriage, and we interviewed her about her marriage, how that marriage came about, who made decisions, how those decisions were made, and then we went and we interviewed the people that those girls had nominated as being important. And we were able to put together what I'm calling a marriage network for each of these girls in each of these villages. And what we found was fairly interesting. Here's northern Cameroon. This is the Mosgoum as a Muslim group. And what we see is a very large, diverse, and interesting network here. So in terms of who's making the decision and weighing in on this marriage, a lot of people. We have uncles being very important, brothers being important. We have all the way into cousins, uncles and neighbors, preachers, fathers, cousins. There's a large, very diverse network of people who are weighing in on this girl's marriage, when it's going to happen, to whom, etc. This is also Northern Cameroon. This is the Mafa group, and they are also, but they are Christian. But nevertheless, we see a very similar kind of network. It's large, there's brothers, there's uncles, it extends out into extended family, brother's friend, brother's neighbor, a very diverse group of people who are weighing in on this marriage. But now when we go to Eastern Cameroon, now here's a Muslim group. Now we would potentially expect the networks to be similar, but in fact they're very different. This is a much smaller network, fairly limited to the nuclear family. We have father, we don't have any uncles in here. There's a brother, but he's a little more peripheral and not as important. So much smaller, much more limited network in terms of how this marriage is being decided. And we see the same thing with this group, the Maka, also Christian, also in Eastern Cameroon, much smaller networks. Now, the disclaimer here is that we didn't really, I can't claim this to be representative. It did, however, it was, however, consistent what we found in the focus groups. And it gave us a really interesting, important insights into the fact that social norms, when we look for them, a lot of times what we look for is geographic variation. So above and beyond something like religion or education, if we see variation geographically in certain behaviors and practices, that gives us clues as to social norms. And that's what we found here, is that depending on the context and size, the context and composition, the reference group can vary greatly. And here we see the big variation is at the level of geography. Oops, here's, okay, so this is the last one. I'm hoping I'm not going over. I said I wasn't going to, and I lost track of time. So what if we have measures of social norms? So this study, we actually have measures of social norms. And this is rural Copan, Honduras. We have 176 villages, and this is a population of 24,000 people, and we have full network data on all of these people. So incredible data set. And we also have measures of social norms. The question of interest here is adolescent pregnancy, and there are very high rates in Honduras, but it's also a lot of geographic variation. So this is a map of Honduras, and we see some areas with very high rates of adolescent pregnancy, and some rates that are much, some districts that are much lower. And this is our study area. So these are the villages that we actually looked at. And again, we see these blue villages are ones with much lower rates, and the red villages are much higher. And we see a lot of geographic variation there. So our outcome was whether or not a girl had given birth as an adolescent, and we limited the population to those who were 21 years or younger so that we could see the association between village level factors and this outcome. We collected measures on individual attitudes. So what's the best age for a girl to have her first baby? And then we aggregated that at the village level. So what did people in the village think was the best age to have a baby? Then we had individual injunctive norms. So if a girl has a baby before age 18, will people in the community think it is good, bad, or neither? And then we aggregated that. So at the village level, what is the aggregated understanding of norms in favor of adolescent pregnancy? And what we found, whoops, oh no, my little things got messed up. Okay, what we found was that individual attitudes were significant. So if a girl thought that the best age for a girl to have her first baby was younger, she was more likely to have one. That's not horribly surprising considering that they've already had these babies. Collective attitudes at the village level were not significant. Individual injunctive norms were not significant, but what was significant were collective injunctive norms. So the aggregation of norms in favor of pregnancy was strongly associated with whether or not a girl had had an adolescent pregnancy. And this is just a plot showing that as the norms increase in the village level, the probability of adolescent pregnancy increases. And since a village is very unlikely to change their norms in response to any one girl's pregnancy, this is relatively good evidence that there is some normative process going on here. And then we did a grouping analysis to look at this geographically, and what we found was that there were definitely significant groups geographically in terms of the association between the norms and the pregnancy. So, sorry, let's see here. The green group are low levels of norms and low pregnancy. The red groups are high levels of norms and high pregnancy. And we have one little outlier group here, which had average norms and high pregnancy. So now we see there's a geographic difference here. Again, evidence of norms. And then we do something clever with the networks, is that we calculate this network density. So on the left, we see a very dense network, and on the right, or sorry, the left, we see a non-dense network, a loosely connected network, and on the right, we see a densely connected network. And we're going to expect that density is going to reinforce norms, and that's what we see. So if a network, a village, is very densely connected in terms of the network, the norms approving adolescent pregnancy are strongly associated with adolescent pregnancy. But in the village networks that were not cohesive, we did not see that association. So this association, this normative association, was only taking place in cohesive villages. Again, very strong evidence that we do have a normative process taking place here. And so the moral of the story is that if we make assumptions about reference groups, it can be misleading and it can mislead intervention efforts. Identifying reference groups requires close attention to the questions. And social network structure can provide us a lot of insight into the normative dynamics that are taking place within groups. And I want to thank my funders, NIH, the Gates Foundation, and UNICEF, and all of my collaborators. And that is the end of my talk. There's much more that I could talk about, but we didn't have a ton of time. So thank you, everybody. And I think that we're ready to go on to questions.
Thank you so much, Holly. That was fascinating. So everyone on the line, if you want to type your questions into the chat, we could start with the Q&A. I have a couple of questions around, it seems that it often comes up, particularly from people looking for programmatic applications of your insights and findings and methods. What would could you just talk a little bit about how feasible social network analysis for identifying reference groups and its relation to program applications? How feasible is this in the field?
Yeah, that's a great question. People ask that question all the time. And there's varying levels of feasibility depending on what the program is, what the program's goals are. Now, the strongest way, the most robust way to collect network analysis, or sorry, collect network data is to collect whole data, like I showed with the village in Honduras, where we interviewed everybody and we can see where all those connections are. But of course, that is time and resource intensive. And if you're doing a large project at scale, that's not a reasonable thing to try to do. However, and we've discussed this a lot, one potential approach, and I think very valuable approach when you're trying to do something at scale, is to take a few small subsets of that larger population and do that network analysis and understand how those reference groups are interacting with each other and where they are, and then use those findings to inform work at a larger scale. So that's one way of approaching this. And then the other thing is that there are ways that are not full network data collection, where you can actually just ask people in surveys questions about their social networks and get some insights that way. The downside of that is that you are only getting reports from the individual that you're interviewing about their social contacts, and you're not getting any direct reports from those people. So if the person is, say, overestimating another person's behavior, you're not going to know that from that approach. However, you will get an understanding of what that person's perceptions of the others in their surroundings are. And then it's also possible to just interview one person per individual that you've interviewed, which is something that we're doing in Niger. So we're interviewing men and women, we're collecting their social network data, and then we're following up with just one individual that they've nominated so that we get objective measures from at least one social contact. And doing that over a reasonably large population should give us fairly interesting insights into the social network processes.
Okay, thank you. That's very helpful. One of our participants has asked, she wonders what sampling methods have you used for these surveys? I think you just spoke a little bit about that. But
yeah, so that really depends on what we're trying to do, right? So when we're doing full network data, we don't make the claim that what we're doing is necessarily population representative, because to do that, it's very hard to get full network data. So for instance, I've done work with the Gallup poll, and we have nationally representative data on people in that poll, and they've given us social network information, but we're just using their self-reported network information. But if we're actually going into coherent units of social units, like a village or a school or something like that, we get the entire network, but that doesn't necessarily mean that our sampling was population representative.
Okay, that's great. Thank you. Another question is around the software that you use for social network analysis. Could you talk a little bit about software?
Sure. So there's a software that we used in this project in Honduras that actually our team developed called Trellis, that has been used for these larger network studies. Trellis, the advantage of Trellis is that this is for a full network study where you really want to be able to carefully link each person with the social contact that they nominated. So when we're doing full network data, we want to make sure that if I'm nominating Maria Hernandez, that's the same Maria Hernandez that we think it is. So this Trellis software takes photographs of people. So basically, you go into your population, you do a full census, so you know who all the people in that population are, and these are all the potential network members. And then you have their photographs, and then when you go through and you do the network data collection, people can actually identify the individual that they're nominating through the photographs. Now, if you're not doing something that complex, then pretty much any survey software can collect network data. You just have to program it so that each response, so for instance, if I ask someone with whom they discuss something personal and private, and I give them up to 5 people they can nominate, then each person becomes their own field, and then there's questions about each person, and those are maybe person A, and then person B, and then person C, and then person D, and that's fairly easy to do on most survey software.
Thank you. Another question, which we might just kind of talk about them in a potentially related way. One participant is asking if it's possible to do this with very large sample sizes, with populations of 10 million, for example. And potentially related to that, another participant is curious about using social media to identify reference groups.
Okay, 10 million. Yes, well, certainly you could. I mean, if you have it depends on what your approach would be. So people do come up with ways of identifying potentially social networks, some of it through social media. So for instance, getting people's Facebook data. Sometimes they'll use cell phones, who people are calling, and they'll use cell phone data. There are ways that you could potentially do it through apps. So if people had an app on their phone and you ping them, ecological momentary assessment sort of thing, and then ask them who they're with at the moment. And then if you're actually just sampling, 10 million people to send out a survey to 10 million people would be daunting. So yeah, you'd have to come see what you had access to and what you could use to potentially infer networks from other means. And so definitely social media is one way. I use Facebook data for some of what I've done. And the thing is to try to identify who are the important people on Facebook versus who are not the important people on Facebook. So depending on what level of social media data you have, you can see who people respond to the most, where there's actually comments versus just likes, etc. Those are different ways of trying to do that.
Thank you. And then kind of bringing it back a little bit down to a local level, we have a couple of potentially related questions. One participant is asking if there are any examples of an organization or even government institution that is taking social network analysis and reference group identification seriously in implementing a program for social norm change. I seem to, yeah, anyway, I'll let you talk, but I think that there's a Gates Foundation program around social norm change for changing behaviors around open defecation. But I think there are several examples that, would you have any specific examples you want to highlight? And within those, do you know of any examples of educational settings, like school-based interventions or parenting interventions?
Well, so school-based interventions, there is a decent history of school-based interventions trying to use different sorts of social network and social norms approaches. That's been done more commonly, I guess, than it's been done in, low and middle income country contexts. And sometimes what they'll do is they'll ask students to identify who, their most influential alter might be, or alter, sorry, so means social contact. In network lingo, we talked about the ego as being the person who's doing the nominating and the alter as being the person who is nominated. So sorry, I'm trying to keep away from jargon here, but they'll ask the students to identify who they think are the most influential people. And within schools, it's relatively easy because you have this sort of a boundary where you can work within. And so they may, I'd sort of, after having identified those influential people, see if those influential kids get educated or, a certain sort of a social norms change around maybe safe sexual practices, drug and alcohol use, or whatever, and whether that will then diffuse through the schools. What they have found, and this seems very intuitive, and you would think that they would have thought that in the first place, but if they group students together with the people that they themselves have identified as being influential, those programs work relatively well, but not if they group people with people that were just identified by anybody as being influential. And then they have tried norms change interventions across colleges. Some of those have actually backfired because what they've tried to do is to tell people that, try to educate people around the descriptive norm. So, well, you may think that 50% of your student population is binge drinking, but in fact, only 20% of the population is binge drinking. But for the person who's not binge drinking, they see that, oh, well, look, all these other people are binge drinking. So this is called the boomerang effect, where you try to change social norms, but by revealing too much, you actually make something seem normative. And there's been backlash against this in terms of intimate partner violence. So saying that 30% of women in a certain context experience partner violence makes it seem normative, and it feels like, oh, okay, well, if we're engaging in that behavior, then it's not so bad because all these other people are doing that. So community-led total sanitation has basically taken a norms approach. And it has worked very well in places like Bangladesh, but it didn't work as well in India for this exact reason that I talked about at the beginning with that Latrine paper, is that there were some other problems with it, but they didn't take into account this social network aspect. They made the assumption that the social network was the village. And it might be, I know the people who are doing that program in India, but I don't know a ton of details about their social network approach. I don't think they're using full network data, but I'm not actually sure. I'm going out there in September, and I'm really curious and interested to hear more about what they're doing. It's very, exciting work.
Thank you. So a question also that's a very interesting one that's come up, I think can be related, is around how a social norm change approach and social network analysis within that might be able to better understand how different profiles or members of the population, could be youth, could be related to youth workforce development. How are they geographically kind of interacting with their environment? Is there any kind of, relationship between social networks, maybe their density or their looseness related to the spatial environment or geography?
Yes, and that's something this is where my work is going. I'm starting to look a lot more at geography and doing spatial analysis overlapping with social network analysis, and I'm really, really excited about that, trying to understand where geography plays a role and where it doesn't in terms of networks. I mean, in general, we know that when people are physically proximal to each other, that their relationships will tend to be stronger, but that depends so much on context. What I found, and this is very, very preliminary, so I'm just throwing this out here just as a discussion point, but in that Honduras data, I have evidence of the fact that if you remember, the village level norm, the collective norm around whether pregnancy as an adolescent is acceptable or not was predictive of a girl's adolescent pregnancy. And we saw that that varied by how dense the network was. But what I also found was that varied by how far from the mean distance in the village the girl is. So if the girl is geographically distal from the rest of the village, that norm doesn't seem to be as influential. Does that answer that question?
It does. So we have about 7 minutes left, and a really important and I think interesting question. It's one that has come up in conversations again and again. So it's the question of aggregate measures of individual self-reported attitudes. Hold on one second. Sorry, the screen is jumping around. Sorry, just one second. I have to scroll back up. Self-reported attitudes is a proxy of a norm in a context. So similar to the example you gave of the study in Honduras, can it be a safe assumption that aggregate measures of individual self-reported attitudes can be a proxy for a norm?
I don't think it's a safe assumption. I think it's a reasonable starting point.
Okay, reasonable starting point.
For a bunch of different reasons, and that really depends on the context. But people do that a lot with DHS, and it's obvious why they do that, because that's what you have. You have attitudes, and you have clusters. And so the two problems with it are, one is that you don't actually have the norms. You don't actually know what people think other people are doing or are expecting of them. You only know what a person themselves thinks is appropriate. And then the other problem with that is that you can't necessarily assume that a DHS cluster is socially relevant. So there is that assumption, but it's not necessarily a relevant assumption because it's very broad.
Okay.
It's very coarse. We'll just say that approach is definitely doing the best that you can with what you have, but it's just coarse.
Okay. And kind of going back to our question about feasibility of applications and program intervention design and implementation and evaluation, when trying to reach people who may be socially isolated or separated from their families or communities or social networks that they're might have otherwise been closely involved in the past, how can they be reached? Or does it become about identifying who their alternate social networks may be? And I guess it goes back to your point around intersecting social networks or different social networks.
Right. Yeah. I mean, I'm trying to figure out.
For example, the specific example.
Exactly what that question means.
The participant had in mind was examples of young men joining armed groups away from home.
Oh, okay. Yeah, that's really interesting. Yes, because when people do, so we see that when people leave for instance, they may be in a village where there's a very strong normative context, and then they move into a city where there's a lot of different exposures, that definitely their perception of what's normatively acceptable changes. But potentially when they go back to their village, they may or may not revert back to their sort of original normative state, shall we say. So yeah, that's a super, super interesting question, and I don't think that it's been explored in a ton of detail. But I just saw a talk at APS, and it was very interesting. It was talking about, oh no, maybe this was at PAA. Sorry, it was talking about people who lived in rural villages in Thailand, and then they moved into the city, and where the change in their sexual behavior seemed to stem from. And it seemed to be that the people who, so they were trying to differentiate, are the people who left the villages just different kinds of people, and that's why when they get to the city they change their sexual behavior, or is it actually that they're getting influences from the city? And if I recall, the results were showing that the norms had actually just changed within the city context, and that their sexual behavior changed as a result of that. So that's a very rich and interesting field of study that there's a lot to learn from, especially as people are urbanizing more and migrating. There's a lot of social upheaval. You know, we talk about villages and they can be quite coherent and cohesive if people have been living there for decades, but in a lot of contexts, people are starting to move around. There's political instability, economic instability, and that's really changing the way people's networks and norms are operating.
Great. So we only have just a couple of minutes left. Would you be able to talk a bit about the costs that may be involved in conducting a full social network analysis, and what kinds of skill sets would be needed?
Okay, well, that's an interesting question. I think a lot of that has to do with how, if an organization is well situated within a community and has workers already and infrastructure, then I don't think that conducting a social network survey is that difficult or expensive. I mean, it's certainly there's going to be some more time because you're taking a census and you're interviewing more people. But if you have the software set up and you understand how to use it, those are the main skill sets, and just really understanding what the potential biases are. You know, for instance, if a person only names one individual in a question and the surveyor hasn't been trained to probe a bit, then the network may be underrepresented because of just, you know, lazy surveying and things like that.
Okay, thank you. And the software you mentioned, Chalice, is that publicly available?
I believe it is, yes.
And is it for a fee, or is it open source?
No, it was open source. The Robert Wood Johnson Foundation, I believe, funded that, and our colleagues at Yale spent a long time working on that software. And yes, I believe that it is open source and publicly available. I don't know how well refined it is at this point, but yes.
Okay, perfect. Well, thank you so much again, Holly. It's really been a fascinating webinar. I've learned a lot. I hope everyone on the line feels that they've learned a lot. We have a couple of remaining questions, but I'll respond to people offline to those. So please don't feel like I haven't responded to given you an opportunity to get a response to your question. So we have our last slide with some links and contact details. Please be in touch. Let's continue the conversation. And thank you warmly again for being with us. Take good care.
Yeah, thank you so much to everybody. It was very fun, and thank you to LINEA and CPC for inviting me, and LINEA, right? LINEA and CPC for inviting me. It was wonderful. Thank you so much.
Thank you, Holly. Bye, everybody.